Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about stages of syphilis. Syphilis is a sexual transmitted disease caused by Treponema pallidum bacteria. Syphilis can be separated into four different stages: primary, secondary, early non-primary, non-secondary, and unknown duration or late syphilis. It may lead to ocular, otic, and neurological involvement. This may occur during any stage of syphilis. A single chancre marks the onset of the primary first stage of syphilis, but there may be multiple sores. The chancre is usually, but not always, firm, round, and painless. It appears at the location where the syphilis enters the body. These syphilis symptoms may come and go for up to 2 years. They include body rashes that last from 2 to 6 weeks, often on the palms of your hand and the soles of your feet. There are lots of other symptoms, including mild fever, fatigue, sore throat, hair loss, weight loss, swollen glands, headache, and muscles pain. Secondary stage, it may some manifestation like a rash may appear from 2 to 12 weeks after the chancre develops, and sometimes before it heals. The rash often forms over the body, often on the palms of the hands and the soles of the feet. The rash usually consists of reddish brown, small, solid, flat, or raised skin sores that are less. Syphilis is curable with the right antibiotics from your healthcare provider. However, treatment might not undo any damage the infection can cause. A single injection of long-acting benzazine penicillin G can cure the early stages of syphilis. This includes primary, secondary, or early latent syphilis. CDC recommends 3 doses of long-acting benzazine penicillin G at weekly intervals for late latent syphilis or latent syphilis of unknown duration. Syphilis is an infection caused by a bacteria, so it is curable disease. Symptoms of syphilis include small sores, ulcer on your penis, vagina, or around your anus. These are usually painless and you may only have one of them. Sores in other areas, including your mouth or your lips, hands, or anus. White or gray wart growths, most commonly on your penis, vagina, or around your anus. A rash on the palms of your hands and the soles of your feet that can sometimes spread all over your body. This is not usually itchy. White patches in your mouth, flu-like symptoms such as high temperature, headaches, and tiredness. Swollen glands, patchy hair loss on the head, beard, and eyebrows. It can take 3 weeks or more for the symptoms of syphilis to appear after you are infected. Most often, it spread through sexual contact. The disease starts as a sore that's often painless and typically appears on the genitals, rectum, or mouth. Syphilis spreads from person to person through direct contact with these sores. It also can pass to a baby during pregnancy and childbirth, sometimes through breastfeeding. After the infection happens, syphilis bacteria can stay in the body for many years. without causing symptoms, but the infection can become active again without treatment. Syphilis can damage the heart, brain, or other organs. It can become life threatening. Early syphilis can be cured, sometimes with a single shot of penicillin. That is why it is the key to get health care checkup as soon as you notice any symptoms of syphilis. All pregnant people should get tested for syphilis at their first prenatal checkup. Symptoms of primary syphilis, it may develop in the stages. The symptoms vary with each stage, but the stages may overlap, and the symptoms do not always happen in the same order. You may infected with syphilis bacteria without noticing any symptoms for years. The first symptom of syphilis is a small sores called the chancre. The sore is often painless. It appears at the spot where the bacteria entered your body. Most often with syphilis develop only one chancre. Some people get more than one. The chancre often forms about 3 weeks after you come in contact with syphilis bacteria. Many people who have syphilis do not notice the chancre. That is because it is usually painless. It is also may be hidden with the vagina, within the vagina or rectum. The chancre heals on its own within 3 to 6 weeks. As regards secondary syphilis, you may get a rash while the first chancre heals or a few weeks after it heals. Often it is not itchy, might be so faint that it is hard to see. The rash often starts on the trunk of the body, that includes the chest, stomach area, pelvis, and the back. In time, it also could appear on the limbs, the palms of the hands, and the soles of the feet. Along with the rash, you may have symptoms such as wart-like sores in the mouth or genital area, hair loss, muscle aches, fever, sore throat, tiredness, also called fatigue, weight loss, swollen lymph nodes. Symptoms of secondary syphilis may go away on their own, but without treatment. They could come and go for months or years. Latent syphilis: if you are not treated for syphilis, the disease moves from secondary stage to the latent stage. So, tertiary syphilis after the latent stage, up to 30% to 40% of people with syphilis who do not get treatment have a complications known as tertiary syphilis. Thank you very much.